Thank you, Jim. That was a very nice introduction. I wish my mom and dad were here to hear it because they would have believed some of it. But I'm impressed with all of you stalwarts here tonight, late on a Sunday evening after long days of meeting. But I also know that you may have dinner plans, so if you walk out on me to go to dinner, it's okay. I'm not going to take it personal. But it's a privilege and an honor to be here. It's a very humbling experience to stand before you and see so many friends and colleagues that have impacted my life in so many positive ways and from whom I have learned so much. I continue to learn from all of you, and I realize I still need to be educated in so many areas, and therefore I need to remain a perpetual student. So let's talk about leveraging the power of prevention in our global quest for better health and safety. I'm going to give you a brief overview of the presentation. There you have it. 3 questions of asking why, how, and what. And I know that doesn't lead to much satisfaction, and I'll fill in the detail in a little bit. But I learned along the way, it's important to ask the right questions in the right way to get the right answer. And I'm going to share a story about that. Robin and I were going to Florida for the first time, driving down way back in the day, and there's a road sign on the side of the road says, "Welcome to Kissimmee, Florida." At least I thought it said Kissimmee. And she said, "Hey, Elmo, it's Kissimmee." And I said, "Well, how do you know? We've never been here before." And she said, "Well, trust me." So we're a little competitive, and so we decided to bet dinner on it. So we go to the restaurant. The waiter comes up, and I say, "Now, before we order, I need to ask you a question, and depending on how you answer the question, will dictate how I order." And he looks at me kind of squirrely, and so I said, "Now, tell us where we are, and say it slowly." And I'm elbowing Robin, you know. And he leans over and he says, "Burger King." So I realized early on I should be more specific. All right. So why is prevention so incredibly important and so desperately needed on a global basis? That's the first question. How can the power of prevention be leveraged? Some examples of that. And what are some recent, compelling, and innovative prevention initiatives? Now, before I go into a lot of the detail in that regard, I'm going to talk a little bit about my why. Why I got in and followed the pursuit of prevention and got into occupational medicine. A great philosopher once said, "When you come to a fork in the road, take it." And you remember who that great philosopher was. It's Yogi Berra. So this is my story of coming to a fork in the road where the compass settings on my career path changed, and it led me to occupational health and preventive medicine. Now, I have never shared this story publicly. A few of you, I've told this in private, but I want to share it with you. I think we have been told that it's as much not just what we do, but why we do it that really leads us on our paths in life. And so I want to talk a little bit about that why. We don't have a true health care system. We have a sick care system. And just as most of you have experienced on the front lines, in that sick care system. Every day there is this seemingly endless parade of people with illness and injury where we step in, we greet, we treat, and we repeat day after day. And I was caught in this unending cycle until one day I was stopped cold in my tracks. It was late in the afternoon on a Sunday. I was catching up on paperwork in the emergency room after one of those bizarre full moon Saturday nights where I'd been up all night with patients suffering from everything imaginable. I mean, you know what I'm talking about, where truth is stranger than fiction. And we received a call on the radio in the emergency room from an ambulance indicating that they were bringing in a person that had an apparent massive heart attack while driving, and then they were unable to resuscitate him when they arrived on the scene. So after they brought him in and placed him in one of the back rooms, it was my job to go in and officially pronounce him dead. And I pulled back the sheet, and I saw he was very obese. And I saw a pack of cigarettes in his pocket. And his ID was on the gurney beside his lifeless body. And he was 37 years old. I paused for a second, but I didn't have time to ponder it because I had to get back to seeing patients. Going from bay to bay, room to room, sorting through medical histories and symptoms, giving it a name, handing out a pill, doing a procedure. You know the drill. I was stamping out disease. I was saving lives. This was just a relentless onslaught of people in pain and suffering from the battlefields of daily life. And on occasion, I would come upon patients that would question how their condition could have been prevented. Novel thought. But after leaving their bedside, I would actually stare into the abyss and ask myself that same question. The heart attack victim's medical record was then dropped onto the desk next to me. I opened it and found that he'd been seen twice in the last 6 months. Once for a sprained ankle, once for a skin rash. The ankle was x-rayed, the rash was medicated, and he marched on to his date with death. No blood pressure was recorded, no weight recorded. They were focused on the task at hand. I paused because the next entry in his medical record was mine. Dead on arrival, apparent sudden myocardial infarct. I looked up at the entrance to the emergency room, noticing that late afternoon shafts of light coming in through the doors, as if they were beckoning me to come outside, get some fresh air, out there where people are alive and well. But then I snapped back to reality as I watched those automatic doors open with a gasp. And a frantic young mother rushed in, pulling a little toddler. It was the victim's wife, and now I had to tell her the bad news. The nurse ushered her and her little boy into an exam room, and I walked in. I said I was so sorry to have to tell her, but that her husband apparently had a heart attack while he was driving, and that even after the EMTs did all that could be done, he could not be revived. I watched the grief hit her face and drain into her trembling body And then she surprised me. She reached up, grabbed my collar, pulled me to her, and said, "This is not possible. His dinner is in the oven." Something snapped. You know, the young mother's distraught face as she kneeled and sobbing, holding on to her little boy, is as vivid to me today. And at that moment, with those words cutting into my heart like a scalpel, something changed. You know, as a survival skill, I had learned to become numb to those kind of situations, but not this time. It hurt. I was devastated, and I walked outside to pull myself together, but I began to wonder how many other people would not make it home to dinner that night. I even began to question what I was doing. Was it all for naught? It seemed the pain and suffering was overwhelming, and our medical care system, albeit a great system, was apparently inadequate, as we could not stop that raging river of illness and injury that flowed with such a vengeance in our population. So I was at a crossroads. I was even thinking about leaving medicine altogether and go back to the farm. Remember that picture I showed you a few years ago, being on the farm? That was a safe place for me. So I thought about starting farming again. However, upon further reflection over those next few days, I came to the realization that yes, it was a tragedy that that little toddler was going to grow up without a daddy. But it was a bigger travesty in that it was very likely preventable. Well, I decided to pursue preventive medicine. And by divine intervention, I started working at an occupational health and wellness clinic on the waterfront in downtown Seattle, Washington. I had not even heard of occupational health or preventive medicine in my prior training years, but I found out I liked it. I liked this new specialty. I thoroughly enjoyed working at that clinic. In fact, I even had Starbucks as a client when it only had 30 employees. And Howard Schultz, this little upstart CEO, would invite me up his rickety stairs from the roaster floor to his office, and we would taste new, different kinds of coffee. I wished I'd invested in the company, but anyway. So, all right. Let's turn to that first question. Why is prevention so incredibly important and so desperately needed on a global basis? Well, first of all, the World Economic Forum talks about the silent epidemics of chronic illness, and that chronic illness is destructive and debilitating to individuals as well as nations, and ultimately a threat to peace. In fact, even in this country, we're having a significant problem in people qualifying for the military because of not being fit for duty. Then the World Health Organization, Dr. Chan, the Director General, talks about that these chronic, non-communicable diseases have overtaken infectious diseases as the leading killers worldwide. It's no exaggeration to describe the situation as an impending disaster, a disaster for health, for societies, and for national economies. In an issue this month, April 2017, of Lancet. They looked at investments in adolescents' health and well-being are some of the best that could be made, resulting in a 10-fold economic benefit. And it would be vital in pursuing the United Nations Sustainable Development Goals. So there's 1.8 billion adolescents in the world today, the largest generation of adolescents in history. And yet, given the rates of obesity and diabetes, it may be the first generation of adolescents that will not have a lifespan as long as the generation preceding it. Sad story. Well, there are 5 lifestyle behaviors that produce 5 chronic conditions that yield 75% of all the deaths worldwide. In a January article in the Lancet, they talked about the rising levels and the epidemic of diabetes. We're on the brink of a catastrophic epidemic of diabetes. The latest global estimates in the International Diabetes Federation forecast that by 2040, 642 million people will be living with diabetes. And you've all seen the story here with the maps. In diabetes and obesity in the United States, you don't want the dark colors, but we are getting them everywhere. That means very high prevalence rates in the obesity and the diabetes. That's on a big scale, and sometimes it's hard to personalize. Well, I'm going to give you a personal little vignette here, though. That last slide was between 1994 and 2014, 20-year period. So this is George in 1994. He was 35 and healthy. He was 6 feet tall, body mass 20. He was a successful businessman. And in our sick care system and our society and its indulgences, 20 years later, this is George. Had diabetes, cardiomyopathy, congestive heart failure, obviously a huge weight gain. His specialist told him he had a 75% chance of being dead in the next 5 years, suffered from depression, and he was unemployed. So I wanted to just ponder for a second and say, well, what if we actually did have a true health system, and that was education and empowerment to individuals to have a healthier life? Well, what would that alternative look like? Well, his weight would be good, he's exercising regularly, feels great, no depression, business thriving, got a good relationship with his primary care provider, getting preventive health care visits as appropriate, and his physician says he's got a 75% chance of living well into his 90s. He's living the life. The only thing he's worried about is some graying hair. And I went ahead and did one of those computer composite things of how he may look in this alternative future. So, it's all good. It's all good. Well, why are employers so interested in wellness and population health management strategies? I've borrowed this slide from my esteemed colleague, Dr. Bossi, that she put together as she built the business case in her C-suite to get these kinds of initiatives in place. 4 things: the inexorable rise in U.S. healthcare costs, and about a third of those costs being waste, and the prevention efforts that could eliminate 30 to 50% of the illness burden that drives the majority of those costs, and the massive safety and quality issues in the U.S. healthcare system, 200 to 400,000 deaths per year, and a 10 to 20 times sublethal events per year of that amount of people in our system. It's a dangerous place to be in the hospital. But the biggest issue is the business value of health as a key driver of other corporate priorities. Employee health and safety, performance engagement, loyalty, morale, attraction and retention of employees, and corporate reputation, reliability, and sustainability. In a lot of ways, you've heard me say, I think health and well-being is the new green. It's the ultimate sustainability strategy because it's dealing with not just the external environment, it's the internal personal environment and really our ultimate carbon footprint. Well, she also had slides talking about the link between health and safety. And these are the relative risks, the odds ratios of experiencing a safety incident or an on-the-job injury with these different risk factors. That's significant to have 2.5 times higher likelihood of an on-the-job injury when you have high stress, when you have a chronic health condition like diabetes, et cetera. And a study that was done through the UL Integrated Health and Safety Institute actually looked at the average cost of a musculoskeletal work comp injury nationally in this data was around $7,000. But if a person had a comorbid chronic condition, it was $13,000. If they had 2 conditions, it was $30,000. And if they had 3, it was $90,000. We've all seen them. But the good news is 80% of heart disease, 80% of type 2 diabetes, and 40% of cancer are preventable if people would just eat healthier, not use tobacco, and have some physical activity on a regular basis. I'm not talking about running marathons like my good friend Richard Herron does all the time, but I'm just talking about walking, getting physically active. In fact, Hippocrates told us this. Walking is mankind's best medicine. Ramazzini. It's much better to prevent than to cure, and so much easier to foresee future harm and avoid it rather than have to get rid of it after having fallen prey. And that was in his 13th oration. And then there was a poem written in 1895 by Joseph Malins from Worcester, England. It was entitled Ambulance Down in the Valley. 'Twas a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant, but over its terrible edge there had slipped a duke and full many a peasant. So the people said something would have to be done, but their sentiments did not at all tally. Some said, put a fence around the edge of the cliff. Others, an ambulance down in the valley. Then an old sage remarked, it's a marvel to me that people give far too much attention to repairing the results than to stopping the cause, when they'd much be better off aiming at prevention. So let us stop at its source, all this hurt, cried he. Come, neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the ambulance down in the valley. We've got a great system with a lot of ambulances. We need to find more ways to have fences. And of course, then you have Mark Twain. He says, the only way to keep your health is to eat what you don't want, drink what you don't like, and do what you'd rather not. And in fact, a lot of people think more about their pet health than they do themselves. And the problem is, prevention and health, it says easy, but does hard for too many of us. But there are 5 health factors that can mitigate chronic illness. And if a person had these 5 health factors, they would result in 33 to 50% less lifetime health care costs. And if 75% of Americans had it, we'd save between $600 billion and $1 trillion per year. Now, I know At least I don't use trillion in my checkbook. So I want to give you what that is. If you have 1 million seconds, it's 12 and a half days. 1 billion seconds is 32 and a half years. 1 trillion seconds is 32,500 years. A trillion's a lot of money. And if a person had those 5 health factors, they would also enjoy what's called the compression of morbidity. We're born in the US, we get in our late 20s, early 30s, and we're at the peak of our health. We're invincible, but then it's all the proverbial downhill from there. And our health risks get worse. But if we paid attention to eating healthier, getting some regular physical exercise, not using tobacco, we could have that top dotted line, which gives you a higher quality of life. You add years to your life to your years, and then you can enjoy sudden death in overtime. This is the science of the compression of morbidity, and it's been shown for 30 years that that's actually what happens. And that slide I showed to Senator Tom Harkin, who was the chair of the Health, Education, Labor Pension Committee before he retired, but he got it. He said, we need to find ways to help enable and empower employee health initiatives around this country. We need to graduate healthier retirees into Medicare and maybe make Medicare sustainable. Let's go at the how. How can the power of prevention be leveraged? I mentioned in my opening comments about the river of illness. Well, we can do primary prevention. We can keep people from falling into the river in the first place. That's what D. Eddington has taught us over the years. Keep the healthy people healthy. It's one of your best strategic initiatives you can do, one of your best returns on investment that you can get. But then we could do secondary prevention, earlier diagnosis and detection through evidence-based screening, so they don't have so much complications and comorbidities. And we could do tertiary prevention, evidence-based disease management, disability management, help them keep from falling over this waterfall of hospitalizations, complications, comorbidities, and poor quality of life at high cost. We can do that. We do it all the time in our specialty. But we need to expand the basis in where and how we do it. And go beyond whole population health management to whole person empowerment. All the different domains of well-being. You know, the World Health Organization defined health as a state of complete physical, mental, social well-being, not merely the absence of disease or infirmity. So well-being is not just the absence of illness. In fact, all these domains, I think, are the roots of a tree of well-being. That all these come in balance for an individual, and a more holistic approach. Well, internationally, there's great trends showing the percent of employers that are implementing some form of workplace wellness program. But then it always comes up, yeah, but does wellness work? And the bottom line is, yes, wellness works and prevention pays if you do it in the right ways. But if you just do random acts of wellness, it ain't gonna work. And you're gonna be really frustrated because you're not gonna get an ROI. But what this paper found by doing a meta-analysis of the literature and of case studies are that if you do it in an evidence-based fashion, like Dr. Bassi has done in her years at Dow, then it works. So let's go to what? What are some of the recent compelling and innovative prevention initiatives? Well, first one I want to serve up my good friend, Dr. Koji Mori, sitting in the audience from Japan, is the chair of this new initiative of the Japan Ministry of Economy, Trade and Industry, and the Tokyo Stock Exchange, where they have created a health and productivity stock selection. Since 2014, they utilized this stock selection portfolio as an attractive investment option for investors who prioritize the improvement of corporate value from a long-term perspective. This health and productivity stock selection is conducted with the expectation that the program will become an incentive for more enterprises to undertake health and productivity management practices. Kudos. I applaud what's going on there. We need to be doing that kind of thing here in the US. You know, when we put that integrated health and safety index together so companies could see how they do, one of our aspirations was to be able to engage the financial community and have them pay attention to those companies like that win the Corporate Health Achievement Award. And we've done those studies. Ray Fabius led those, where we showed that these types of companies outperform the S&P 500 in the stock market. I'm going to end with something that's near and dear to my heart here. We have the privilege of working with a very large hospital health system as a client, as an employer, and they've been doing some phenomenal things around mental emotional health, well-being for their workforce. And part of this is there's a paper that's going through a review process. We hope it will have a chance to get into JOEM sometime this summer. But we pulled together leaders from various large hospital health systems and thought leaders around the country, some in this room, as you see up there. And it was about the way the Institute of Medicine's groundbreaking report, To Err is Human, focused on patient safety. I think you all remember that. Well, more recently, a new topic has begun to emerge, the health and safety of those who deliver health care, from physicians and nurses to administrative and service personnel, and how their health can impact the health and safety of the patient. It's becoming clear that workers in this high-stress, demanding sector are themselves prone to a wide variety of health risks and conditions, including depression and burnout. Healthcare workforce is particularly unhealthy. 55% of nurses are obese across this country. 28% of LPNs smoke. A significant percent of emergency room staff suffer from addiction. They're high utilizers of medical services, and problem is, most of that are just curbside consults. So they don't really get evidence-based care or preventive care. And the stress and depression levels are considerably higher. There's a phenomenon called the second victim syndrome, maybe you've heard about. And that's when a healthcare worker experiences, through the patient's trauma or death, their own trauma. There's an unfortunate case that has been lifted up nationally right now as an example from the family of a nurse that gave an infant in the hospital the wrong dose of medicine. The infant died, and the nurse was so overcome with grief she committed suicide. So I think stress is the most ubiquitous toxic exposure in the healthcare workplace. So when we did this initiative with this hospital health system, they told me, knowledge is king and data is the key to the kingdom. So let's analyze our data. So that's what we did. We looked at their medical and pharmacy claims, and we looked specifically at 9 common chronic conditions and the costs associated with them and the number of people that have them. And on the mental health 6, the MH6, those were the common 6 mental health conditions: depression, anxiety, bipolar, eating disorders, post-traumatic stress, and substance abuse. And you can see that in this comorbidity table, there were 13,729 people out of the eligible population of 40,600 that had one or more of these 9 conditions. That's 34% of the population. In fact, you can see how many people had how many conditions. At the bottom there, 6,944 only had one of the 9 conditions, but towards the top, there were a few people that had multiple conditions. We then look at what we call a comorbidity matrix table. And the mental health 6 was by far the highest prevalent chronic condition. And of those that had mental health condition, you can look across that top line and see the other comorbid conditions that they had at the same time. So 7,005 people with one or more of these mental health conditions represented 17% of the total eligible population and 51% of that 13,729 that had a chronic condition. Well, so we do another part of their initiative is to let them take a health risk assessment, a health and well-being assessment is what we call it. And we intentionally built into that an instrument, it's a nationally validated instrument called the PHQ-4. I'm sure you're familiar with it. But it's a screener for anxiety and depression. And if a person triggered positive, it then served up immediately branching logic as they were going through their health and well-being assessment to either get the full GAD-7 for anxiety or the PHQ-9 for depression. Well, over these last 5 months, we've had 10,368 people from that hospital health system complete their health and well-being assessment. 70% were not at risk. 30% were. And when we looked at the other health risks, that 15 Eddington risks like blood pressure, fasting blood glucose, BMI, the people that were at risk in that 30% are represented by the lower PHQ-9 greater than 0. Look how much higher health risk in general they were compared to the 70% that did not trigger for mental health risk. So, I'm wondering whether mental emotional risk factors are actually the taproot of a tree of ill-being. And it deserves our utmost attention. Because when we went on then and looked at that 30% that were at risk, we found 5% that were high risk. And on our platform, as they complete their health risk assessment, it flags our nurses, and our nurses could reach out, engage them in a phone conversation, and then assess them and refer them either to the employee assistance program, to their primary care physician or a mental health specialist, or into our nurse care management for depression and anxiety, or into health coaching for stress management. And the most profound thing about this whole exercise to me is that 80% of those individuals with the highest risk of depression and anxiety are now engaged actively in health coaching for stress management and in care management for depression and anxiety. For an old gray-haired preventive medicine physician, that cranks my chain. That's what gets me up in the morning. These people, very few had been diagnosed with depression or anxiety previously. These thousands of people that were living in lives of quiet desperation because of the stigma. And let's just not talk about it. Well, I got news for you. We need to talk about it. And this is a study that just came out in ACOEM, and it talks about that employers are adopting these resiliency training programs at a rate faster than any other intervention right now. That resilience extends beyond one's inherent predisposition toward life events and includes a set of acquired skills that mitigate the experience of stress, speed productive responses when setbacks occur. The most notable effects of resilience are the 10 to 20% lower rates in depression, absence, and productivity loss when resilience is high. So instead of mental and emotional health being an afterthought, let's bring it out of the shadows, take away the stigma, and bring it to the forefront of what we do in employee health and wellness and population health management. And I would propose we create a new form of ergonomics, mental emotional ergonomics. So let me close. I think we're on the verge of a transformation from our sick care system to a true health system built on the pillars of prevention. So as I finish, I want to hearken back to what I mentioned earlier, and that was to how thankful I am to have been given the opportunity of learning so much from so many of you along the way. It is so important, as Dr. Bassi mentioned, we didn't even know what each other were going to say. But as she mentioned, it's so important to share the journey with friends and colleagues that you trust and admire and can learn from and share the journey with. In fact, in these final moments, I want to share one of those very magical times where I was able to share with two colleagues back in 2010. And that was with Dr. Dame Carol Black from England and Dr. Bill Glass from New Zealand. I think everyone knows Dame Carol. She spoke here at the AOHC previously. She's been knighted by the Queen twice for her impact in healthcare in the UK. She was the first woman to be inducted into the men's Athena Mum Club in London in 2002. So she arranged a dinner at the Athena Mum Club to have her and her husband and Robin and I and Dr. Glass and his wife. This is Dr. Glass there on the left and his wife, Grace. We were all there because we were going up to this Society of Occupational Medicine meeting in Edinburgh, Scotland at that time. But that night, she arranged that we could eat dinner out on the lawn. It was a rare, beautiful, warm summer evening in London, and she arranged that we would have dinner out there. I mean, literally, it was an amazing evening, and we sat beneath that oak tree in that private garden behind the club, and as we talked, I became transfixed, and I was amazed at how Carol, Bill, and I were such kindred spirits with a common cause on a common journey. And that even though we were going to be continuing on our journeys a world apart geographically, we were now knitted together professionally and personally. And as the evening turned into night and the candlelight burned bright, we paused and raised our glasses of Cabernet, and Bill Glass declared, let's make a commitment to help each other, help all those we are privileged to serve, to actually help make the world a healthier and safer place. This is our quest. Our quest. It was a magical moment, and it fanned the flame of my purpose and passion for prevention and occupational health. You remember Don Quixote? Speaking of quests, the man of La Mancha who pursued his quest to seek out good and innocence in a world filled with darkness and despair. He said, all that matters is that I follow the quest. I will act as if the world were what I would have it to be, if the ideal or what's real. Don Quixote acknowledged that at times his dream of a better world seemed impossible to achieve, maybe even an impossible dream, the song that was in the movie. And yet he forged onward. And like Don Quixote, we will face obstacles along the way, but we must be of the mindset that no matter how hard it may seem, no matter how many challenges we may face, it is worth the effort. And the journey, no matter how tough, is rewarding, especially when we are encouraged and inspired by friends and colleagues to move onward and upward in pursuit of our common cause. The potential impact by leveraging the power of prevention can be profound. Reducing the burden of risk and illness in individuals and in populations, improving the health and productivity of workforces around the globe, enhancing the vitality of national economies, and ultimately helping make the world a healthier, safer, and hopefully more peaceful place. That's what the global quest comes down to, and it's worth to keep striving for, and maybe, just maybe, more people will get home for dinner with their families. Do well and be well. Thank you very much.